Are there other steps outside of having a good therapy program, good fitness program like we talked about for their core, for their scapula, for their rotator cuff specifically, other steps that you recommend to swimmers to improve their longevity, their athletic performance over time? Because you made the analogy to baseball players before, same type of thing. At a young age, you're putting a lot of stress across these joints, and if your ultimate goal is, if you're a high schooler and your ultimate goal is to compete at the college level or the Olympic level, are there other steps you tell swimmers to take to really help preserve their joint?
Well, one of the very best is make sure you got good mechanics. Mechanics trumps a lot of things. If you got good mechanics, you can get away with a little bit of musculoskeletal problems. Musculoskeletal problems can overcome a little bit of bad mechanics, but not much. So mechanics is so very, very important. Really good, training, coaches, education. The other thing is, I know that swimming, by and large, is a sport where you spend lots of time in the water. I mean, that's the culture, that's the atmosphere, that's how you get good. That's no doubt that's the case. But there is a time for recovery, very definitely. And swimming was one of the very first sports to understand this concept of taper, which means you don't peak the day before your meet. You peak a week before your meet, and you taper down so that you don't kill yourself going up to the meet. The other thing is, over and over and over again, we're finding in the 14 to 18-year-old populations that you have to take some time off. You just plain take, not just taper, but time off. You got to clear your psychological situation in your mind. You got to do other things. For example, this big youth business about baseball right now, we're finding that Dr. Andrews is exactly right. You got to take 3 months off from pitching. And if you do that, then you have a much more durable career with much less injury risk. And something that's even more fatiguing, such as swimming, a time off. Now, I don't think we've ever come up with an exact number, but periodized breaks in the season, you just take your time off so that you are still relatively fresh, so that your mind is fresh, so that your body's fresher. Play something else. Do some other type of activity. A lot of dry land training during this time. Your core and your shoulder blade, you can do all that stuff. You can do the swim bench, but that's okay, but not in the water. Those two factors, and then during the season, making sure that your mechanics are still good. Make sure that your coach watches your mechanics so that you're not dropping your elbow, you're not rolling too far, that you're not missing your kicks or something like that. Those are very early signs of fatigue and injury risk that then, if you're not careful, will lead on to other problems. We have one of our teams that we take care of here. It's a Division III school, and they've got good swimmers. They compete pretty regularly, but they're not the very top, and so they come into the season relatively unconditioned, and we see a whole lot of injuries right at the very first of this. Once when they come back in the fall, they start hitting the water again, and then they take 2 weeks off for Christmas, go home, but then they go to Florida for 2 weeks, and when they come back, and half of them are injured because they went from relatively low activity to very, very high activity where they swim, miles every day. They come back hurting. So once again, this periodized where you kind of work through this, you plan some breaks, but at the same time you do some conditioning is very, very helpful.